Hi, I'm Timo Heikkilä from PopIt. PopIt makes medication connected. Why? Because that solves two big challenges. Challenge number one is with the patient. 50% of patients do not take their medications correctly. That's every second person. Taking medications requires too much effort. There is no easy way for the patient to track how they take medications. The second challenge is with the industry. They want patients to take their pills. Every pill not taken means lost revenue. One option is smart packaging, but today's packaging is analog. Changing it is a lot of work and super expensive. The current situation is costing the industry over $630 billion every year. What if medication would be digital and connected? PopIt does that with a simple solution for thousands of medication brands already on the market. It is easy to use with any solid drug that comes in a blister pack. That's 80% of solid medicines on the market. Hypertension, birth control, type 2 diabetes, the list is long. Our solution has three parts: a device, an app, and a cloud. The PopIt Sense device detects with patented technology when a medication is taken. When a tablet is taken, we seamlessly use Bluetooth to send the info to our medically certified app. And the app reminds the patient only if they miss their dose. So there are no needless alerts. The app sends this anonymous data to our cloud. And from the cloud, we can send messages that educate and guide the patient. PopIt is already usable for millions of patients and not just for clinical trials. We have a small team, but we've done big deals. With Pfizer, we have a European-wide agreement and are continuously deploying to patients in new countries. The potential value of that one medication contract over the next 3 years is several million euros. So this is not a project deployment, but scalable business. With Novartis, we're supporting medications in neurology, and we have just announced a new deal, this time with Almirall. With Almirall, we are supporting a medication where adherence is notoriously difficult. We also have over 20 other pharma negotiations in the pipeline. So PopIt is getting traction. Let's see why. In an ongoing collaboration with our customer A, the baseline adherence is 55%, and PopIt is able to bring this up to 80% and above. With a 25% adherence uplift, we're contributing to new revenue, new data, and ultimately healthier patients. The improvement also represents a sales upside of over $12 million per year for this one medication. However, all of this would not work if patients wouldn't get value from the product. A connected medication benefits especially the patients. She takes the right dose at the right time, she responds to the drugs better, and she doesn't end up in the hospital because she didn't take her pills. We connect her to the healthcare professional who can now see what patients are doing remotely. We asked some of our users how they like it. 100% said the solution had improved their medication taking. That's unbelievable, but 100% true. We have very high engagement and customer satisfaction. The medication market is worth over $1.4 trillion. Now, we've started with the expensive medications, but we don't want to stop there. To scale to millions of patients, our strategy has always been to next drive into the mass market like diabetes medications, but at the same time, we're expanding. Connected medication benefits pharmacy chains, benefits also insurance. There is competition, of course. Take, for example, free reminder apps. The tens of pharma companies we've spoken to have told us that their patients are tired of the constant reminders. So they came to us because PopIt has no needless reminders. It's automatic and validated to reduce missed pills, and above all, to work with PopIt, they don't need to change the packaging at all. So you're thinking it's only for one medication type. Well, actually 80% of solid drugs in the world come in the so-called blister package. And the list is very long. The blood pressure medications, the type 2 diabetes, that's over 1.5 billion patients already. And 60% of the patients are actually between the ages of 18 to 65 and taking 1 to 4 medications. This is not a problem with the elderly. The elderly are actually quite good at remembering their medications, whereas the younger patients are not. Our business model is simple. We sell devices to the sponsoring company. We charge a recurring fee per medication per country, and we're starting to monetize on the data. Last year, in 2019, we made 170K. Last year, we increased that by over 25% to 213K, and we already have recurring revenue from pharma on a monthly basis. PopIt is not easy to replicate. We have a US patent, we have a patent pending in Europe, and there's more to come. Our team has expertise from a wide range of industries, and some of us developed a smartwatch and a service for the elderly, while others exited their previous companies to a stock-listed CRO. It's time medication was connected, because that's how we solve the two big challenges with the industry and with the patient. Thank you.
Hi everyone, thanks for giving me a chance to introduce our company Talos. We are developing medical AI solutions. Especially now we are focusing on radiation therapy AI solutions. Let me start. We have set up the company year 20 October. Now we are focusing prognosis and therapy in radiation therapy AI solution. Our future is total care medical AI solution. We are focusing the therapy and prognosis, whereas the other AI company is focusing imaging diagnosis. Our team members have more than 10-year clinical experience and enough knowledge of AI data analysis. We are cross-border R&D between Korea and Hong Kong. These are our supporters group who are providing us data and helping us to evaluate our research results. Dr. Yu, our CTO. CJ Ra, this is me, operating the company, and JH Kim is the Chief AI Engineer. Dr. Min is the Clinical Research Advisor. Next two pages, I want to explain you why we are focusing RT AI solution. First, market background. All those reports show that radiation therapy will grow fast, and due to shortage of medical workers and needs of improving the human error, demand of AI will grow fast. Another reason is in fundamental technology. In order to achieve our MR or RT solution, we need three basic fundamental technology. They refer online retraining, deep learning workflow, deep learning with the unpaired set. As these technologies had been constantly researched and enriched today, all these three fundamental technologies are matured enough to deliver the solution. Red color is our suggesting Talos RT process. We don't need CT. We put our new technology function, prediction of prognosis, auto-controlling, auto-OR calculation. The benefit is saving the time consuming from 1 day to less than 30 minutes and avoiding the over-radiation exposure, and multiple simulation support doctor's decision. Finally, improve accuracy and robustness is helping to improve high therapy effectiveness. This is Talos product, TPS Flat, MR Adapter RT, Talos OER. These are all software modules. These all products are designed by analysis of key buying factors. This is our target specification. Red column is target goal and yellow is our achievement by April this year. You can see 80% to 90% in some items. By the way, we still try to improve all those numbers. This is a comparison with our potential competitors. Basically, all those features and options of our competitors we want to try put inside our product. Also, we investigate Chinese companies. By the way, so far we cannot find any significant progress of a RT-AI solution in China. This is our technology highlight. The left is our key technology factors. The right is our suggesting solution and methodology. This is detail of technology. Blue box is the methodology. Red box is the output result by company April this year. The numbers I show you in the specification sheet all comes out through this process. This is a patent strategy. The blue is our suggesting optimized clinical flow using MR image. And these three red boxes are our products based on our planning patent. These 7 technology patents we will apply in the future, especially yellow box, 2 items will be applied soon, because the research paper regarding these 2 items already published this May on Medical Journal. This means the idea was already evaluated by professional party. This is market size. Treatment planning system market is software $7.2 billion. MRI market is hardware $11.7 billion. This is our target customer list. Ultimately, we try brand marketing after we get FDA approval. This is R&D milestone. Within 2.5 years, we want to complete our fundamental technologies, and coming in 2 and 3 years, we want to achieve evaluation and verification on cancer sites. Ultimately, we want to achieve one-stop solution. These 3 are our R&D papers, especially signal enhanced MRI is just published on this May. This is the MR signal enhancement video clip. You can see left is the original MR source. The right is the reference MR source. The output enhanced MR in the center comes up by input following the reference. This is synthetic CT generation from MRI. Left is the original MRI source, right is the reference CT image. Output result of synthetic CT in the center comes up by original MRI following the reference CT image. Thank you for your time. Thank you.
Hi, my name is Andrew Just and I'm here to talk to you today about Opuz. We're a startup based in Australia developing a blood glucose non-invasive wearable device. Slide 2. Today, blood glucose measurement is painful, inconvenient, and not always so accurate. This is a significant problem given that all the options involve invasive methods, finger prick testing or patches with needles. So the problem we have to solve is that there are currently no accurate and or reliable non-invasive options. Opuz's solution is to develop technology that's a wearable device, a ring, that accurately measures constant blood glucose using the market leader as a comparator and delivers the same results without needing any fingerprints or any other consumables. The system is a ring coupled with artificial intelligence algorithms to collect data from the user, run it through an algorithm and return a blood glucose result. It's pain-free, effortless and real-time blood glucose monitoring. We demonstrated in a recent clinical study that our product, the Opuz One ring, was just as equivalently accurate as the market-leading continuous glucose monitor. So we believe that we have a highly relevant accuracy level with our product. From a competitive landscape perspective, Opuz has several key benefits that are unmatched. So across the spectrum, Opuz can be seen as non-invasive, painless, continuous monitoring, no consumables required, no interference with daily life. It's affordable and accurate. There are no current competitors that can match all of those value propositions, and we can't find an emerging competitor also that could match those propositions. The unit economics look quite good. We intend to sell the ring for $300, positive gross margin, and then provide a monthly subscription service to use the smartphone app in order to get the information, get the blood glucose measurement readings. So this recurring revenue stream from software as a service, we believe will have a high retention rate based on the fact that the underlying need is fairly constant. Our go-to-market plan involves a wellness segment launch, type 2 diabetes, pre-diabetes, and also type 1 diabetes in that order. So we'll look to launch into the wellness market first. It's a quickly growing market that's a little bit easier to access. So at the moment, we're completing the production-ready device and working on our certifications for sale. We'll intend to launch early next year and then continue on the path to getting medical device registration. At the moment, we're moving from our bulky prototype to the ready for production model. This has shown to have very good results, and we believe that by improving the algorithm further, it can be even more accurate than it is today. We're raising capital at the moment, $2 million. This is to fund completion of production phase and also to launch the product. So making sure that we have design for manufacturing down pat, we've commissioned the early production runs and they're successful, and then setting up for launch into key markets. We'll have our registrations achieved, supply chain set up for global distribution, partner agreements secured for promotion and sales, and our key markets prepared for launch. These are the outcomes from the use of funds. Our team is very experienced in both deep tech innovation, but also commercialization. So we have a lot of experience from a technology innovation perspective, but quite importantly, also a lot of experience from a commercial perspective with decades of experience in the healthcare market, and also a very strong underpinning of this omni-channel B2C market approach. So we believe we have the experience to both make and market the product successfully. So investment highlights, Opuz will enter a $10 billion market next year with disruptive tech. Compared to current options, it's cheaper, easier, and potentially more accurate. This market is starved for technology improvements. We believe it will have a very strong uptake, which is confirmed by the feedback we've had from the diabetes community. It's platform technology that can potentially be applied to other areas, and there's definite expansion runway on the revenue streams through support programs and therapy provision. So Opuz, winning in diabetes and beyond, our purpose is really to make blood glucose measurement easier, faster, and accurate. Thanks very much for listening, and I look forward to any questions during the course of the conference. Thanks very much.
Eating is easy, but healthy eating is hard. It is because there is so much information in the internet. Besides, different stakeholders, such as restaurants, seem disconnected from healthy eating. Long-term unhealthy eating is the main cause of chronic diseases. People with poor chronic conditions have suffered much seriously in COVID-19. Therefore, we have Rehealthier. Rehealthier analytic platform aims to provide personalized eating advice as according to user chronic health conditions. And Rehealthier also aims to close the gaps in a healthy eating ecosystem. To understand each user conditions, we have what we call the AI health check. With the algorithms retrained from tens of thousands of health profiles datasets, we could estimate a user's chronic health conditions and risk with their input of body measurements, lifestyle, etc. The science behind AI health check is not just big data, but also human physiology. For example, a person's waist circumference and height can be used to estimate the relative fat mass. From the big data we have, we found it is a very useful indicator reflecting the uric axis for female of a certain age group, as shown on this graph. We have also tested the reliability of our algorithms by comparing our predicted values and actual values. The error rate is somehow more satisfactory compared with other similar studies. And the next step is to guide user healthy eating, and we have created many different eating scenarios. Rehealthier help user to digest food menu. With Rehealthier knowledge base, we provide instant idea to user with very easy to identify color labels. Besides calories, Rehealthier also equipped with many other nutrients comparisons. Rehealthier provides users with personalized eating advice based on their health conditions. We also recognize logos from chain restaurants and digest nutrition labels for users. In our meal challenge, we allow users to compare themselves with healthy peers. With the sponsorship from Hong Kong Science and Technology Park, Rehealthier have been showcased in many different conferences, such as Collision and Web Summit. Rehealthier has been awarded in different competitions. For example, the showcase mobile app Eat Right has been awarded in Asia Smart App in the year 2020. Rehealthier business model is B2B. Partners can subscribe Rehealthier APIs. For example, right now, we have health management clients where Rehealthier add values on their healthy eating parts, and we have insurance companies using Rehealthier to attract their clients and reduce their medical claims. Our reinsurance company is also planning to use Rehealthier AI health check for underwritings. We also compare the same group of users using Rehealthier AI dietitian for more than years, guiding their healthy eating. From the health reports measured in chronic health check in 2 years, we found that their biodata, particularly the fasting blood glucose, uric acids, low-density cholesterol, have been improved pretty well. However, it is not the end of the story. We will have our new solution to be launched, namely Healthy Meals Finder. When users input a meal they prefer, the platform will detect user location and in return suggest the choices of healthy replacement from the restaurant nearby. The healthy replacement is decided as according to user health conditions, meal preferences they input, and their location. Aggregate reports from the platform can provide restaurant actionable insights, such as consumer diet preferences, health needs. With more targeted healthy meal launch, restaurant can also get more exposure on Rehealthier meal finder. In summary, Rehealthier target to build a healthy eating ecosystem. We pay values to reducing medical claims, particularly for insurance companies. We also facilitate restaurants to launch more healthy meals and to get more exposure on our platform. In such a way, end users can improve their long-term health much more effectively. Thank you.
Hello, my name is Niko. Ratala. I'm the co-founder of Healthzilla. Smart wellness at scale. Thank you for the opportunity to pitch on this pitch competition to you. Our mission is to empower people to transform wellness data into healthy habits with a science-based approach, combining four specific aspects. A, wellness data collected from wearables and health apps to be preventive and real-time. B, which is our unique competence, artificial intelligence to create personalized and holistic insights and guidance on a daily basis. C, behavioral health science to help build up and sustain healthy habits over the long term, which is the key towards sustained healthy lifestyle. And D, gamification to keep the whole customer experience fun and engaging indeed. Our unique IP consists of four different steps. Number one, the datasets we've gathered already includes 100,000 over heartbeats labeled with stress or sick, including rich behavioral and demographic data from over 3,000 users. 2. Stress Scan, our proprietary PPT algorithm, extracts high-resolution heartbeat signal from any smartphone camera. This has been validated against clinical-grade devices within plus or minus 5% accuracy. Our proprietary Stress Score AI algorithm performs trend analysis across over 700 different correlations between biometric and behavioral data. And lastly, Stress Scan AI detects signs of stress from heartbeat samples, and the results that our clients are actually getting are stunning. 21% increase in healthy habits, 50% increase in sleep, 50 minutes increase in sleep per night, 70% increase in meditation instances, and reducing resting heart rate by on average 5 beats per minute. So this stuff works. The marketplace is massive. So the 13 trillion or 14 trillion market size in the global healthcare market, we're seeing that to shift from a treatment of disease to prevention, which creates this new emerging market landscape, which we estimate to be about $14 billion, of which our target market, Southeast Asia and Europe, in the first instance is about 40% at 5.5 billion. Target segment, one example is insurance, 1.8 billion, and our market share from that first year 0.01 and growing exponentially from that. Global multi-billion-dollar industries are failing to prevent lifestyle diseases. We've seen this across the board. We will solve their pain points. Insurance, for example, preventing lifestyle disease among customers at scale. So difficult to do. Health and fitness, promoting healthy lifestyle among customers at scale. And workplace wellness, helping employees manage stress and recovery at scale. These can all be done through one-on-one coaching, for example, but that is not scalable and usually pretty cost ineffective as well. So therefore, this is our solution to the market. Our innovation is an AI-backed wellness platform which helps to make lifestyle interventions at scale. The solution includes an application and a dashboard for the organization to monitor and support the progress of their clients or employees. The secret sauce is our proprietary device-agnostic Healthy Habits AI engine, which basically means that you can use whichever wearable device, or if you even don't have wearable devices, our phone camera's proprietary stress scan will do the work for you. We deliver value for our customers. It's very clear. The positive impact on the end user in terms of health span, building healthy habits, living a more enjoyable, healthy lifestyle. For insurance companies, for example, increased profitability through lesser number of claims, increased customer engagement, improved management of health risk. For health and fitness players, we will be able to offer more performance, scaling up your business, more optimized training programs, better scalability of services, increased customer engagement. And productivity-wise, the benefit is clear for the workplace wellness market. Real-time and early indicators of stress and recovery for the employees, for example, quite clear. In the competitive landscape, we are in the digital prevention segment of the quadrant, if you may. So we are very scalable and very preventive compared to a lot of our competition. We're getting really good feedback both from our thousands of B2C clients who've downloaded our app from the App Store for free already. We have 4.5 average stars ratings and getting great feedback from them already. Our first B2B clients love the solution. We did a pilot with Triathlon Finland, for example. They loved it. And our first PT customers are loving the service as well. And momentum is clear too. We've been selected to various different incubators and accelerators. We won hackathons and placed really well in global hackathons. We've received over 50,000 euros worth of non-diluting grants already, partnerships, pilot projects, angel investments, and so forth. And the team is simply amazing. We all have already proven to be able to deliver results in our previous experiences. And the advisory board is simply amazing as well. We have, for example, the ex-Suunto CEO Juha Pinoma and Minna Öhman, MD, PhD, physician scientist in the Duke NUS School of Medicine medical school here in Singapore. The market outlook, the business outlook for our Healthy Habits as a service business is solid, and we are looking to grow the business exponentially in the next 5 years through our specific go-to-market strategies. And we are raising funding now. We are looking to raise 500,000 euros seed capital from like-minded investors to help us to take the business to the next level and quickly as well. If you have any questions whatsoever, please do not hesitate to contact me. Thank you so much for your interest in today's pitch.
Hello, I am John, founder and CEO of WOX.
WOX is an affordable, safe, robotic-assistive, and rehabilitation XR platform.
WOX team consists of John, founder and CEO, with 20 years experience in medical device development and regulations. Dr. Vlad, founder and CTO, medical doctor and expert in neurology, neurophysiology, and neurorehabilitation. Vitali, Chief Product Officer, with 20 years experience in medical device development, product management, sales and service. Sergey and Fedor from engineering team. Disability from after stroke, aging and fatigue is a major problem. Annual growth of stroke patients with mortality reduction lead to increase in disability rate, which increases the demand for assistive devices. Medical and nursing services for medical rehabilitation is not ready for transformation to home care, as well as market does not present any robotized and affordable technologies. Our solution is patented WIX technology with therapeutic methodology developed for movement assistance and home rehabilitation. WIX consists of movable frame, body weight support system, biofeedback, robotic and motion capture modules. WIX is operated by user or assistant, combined with VR and AI has extended functions.
WOX Adaptive Rehab is based on clinically validated methods. The safety and effectiveness of WOX was validated first using after-stroke rehab program of a 78-year-old bedridden patient, followed by 52 patients. Adaptive WOX training consists of a few exercises: holding static position, side deviation, assistive passive motion, continuous passive motion, turn around strong leg or weak leg, linear displacement, moving forward and back, and free walking. The clinical methods are verticalization, continuous passive motion therapy, robotic assisted gait training, balance training.
WOX features: visual biofeedback, safety support with biomechanics, intuitive controls, convenient user controls, comfortable positioning, personalized settings and motion analysis, convenient assistant controls, motion capture, assistive movement control of one or two lower limbs, stable and maneuverable design.
Biofeedback system determines the individual physical activity for neuroplasticity activation through optimal training programs. User follows the screen indicators, and the training stops when the user feels tired.
Under development, AR and AI identifies the surrounding and the obstacles. User visualizes routes in AR glasses from target to target. According to personal abilities and biometry, AI calculates gait route and corrects the user's kinematic, biomechanical activation and electromyostimulation. WOX comes in 3 options now. Mechanical frame with motion analysis, with robotic drivers for both legs, with robotic drivers for one leg. Under development, VR and AI, personalized training, telerehabilitation, electromyostimulation. Physiotherapy market size will be $36 billion by 2027 with a CAGR of 7.7%. The current trends in physiotherapy equipments are for electrotherapy, exercise therapy, CPM therapy, laser, magnetic, pressure and others. The highest penetration and growth rate is for physiotherapy and it is high in Asia and Australia. But the market does not offer cost-effective, safe and user-friendly equipments. Our value proposition is affordable technology and innovative method for home rehabilitation. Our first customers are rehabilitation facilities, B2B. Secondary, we will target home rehabilitation and assistive devices market, B2C. Serviceable and obtainable market of the after-stroke and home rehab in 2025 will be $17 million. Based on our calculation, we will have a minimum 50% profit. Our revenue streams will be through direct sales, usage fee for virtual environment, lending, licensing, subscription for personalized training. None of the existing competitors provides all the functionalities for exoskeleton. WOX is the only one offering multi-functionality, as WOX is designed to train gait stereotype function, balance, spatial orientation, and joints mobility. WOX can be easily assembled at home in 40 minutes. WOX is safe as it has body support and allows monitoring fatigue and physical overload. WOX can be integrated in VR where AI helps to find out and follow the correct route. Motion analysis helps to monitor the rehabilitation progress. WOX come with 5 options designed for different types of movement disorders. And WOX is the most affordable device. We have patented the technology and all possible usage of WOX. We have published literatures and participated in international neurology conferences. We worked with the best medical and research institutions for research and validation of rehab technology. We are looking for $1 million for achieving our next milestones of manufacturing, product certification, marketing, and sales, enhancing our IP and further product development. we would be initiating our marketing activities by December 2021 and expecting the first commercial sales in Q1 2022. Executive Summary: HQ in Singapore and R&D in Belarus and Poland. Team of medical, technical, and business experts. WOX is a robotic assistive exoplatform and rehabilitation exoskeleton solution for movement disorders and motion-related diseases. Indented use of WOX therapy for stroke rehabilitation, Parkinson's disease, multiple sclerosis, and other movement disorders. WOX is a validated and a production-ready product. Basic assistive product ready for immediate marketing as low-risk non-regulated exorcist device. Seeking $1 million investment for production, certification, and marketing.
One of the things that I was worried about as a brand new parent was breastfeeding and when to do it and how many times a day to do it, and making sure that Brinkley was fed well.
I had him in one of those bassinets that was right next to my bed, and I always made sure that my head was kind of close to him so I could hear if anything went wrong.
Just not knowing what was normal and what wasn't normal.
I was worried about not knowing what to do when Charlie started crying.
Hi, I'm Shem. I'm the father of 2 beautiful daughters and the founder of Goldilocks. And all these really simple questions that we have as parents seem really hard when you're feeling out of your depth and completely sleep deprived. So this got me thinking. I'm a medical device engineer and constantly working with doctors who have sick patients who often can't communicate with them. Well, why can't we do that for parents at home? Parents have really simple questions about how their baby's feeling and coping. Why can't we give them a device to help them understand their baby and give them the best care possible?
So we built Goldilocks Suit. Goldilocks Suit is a smart baby singlet. Screen printed on the inside of the singlet is sensors which are detecting your baby's movement and temperature. These sensors then come together into a little Bluetooth module which communicates with your phone. This data is passed through our algorithms, and we collect data on your baby's sleeping, feeding, breathing, core temperature, skin temperature habits. And from this we build up a profile of what's normal for your baby. We can then provide actionable insights to parents about what's normal behaviour and what's abnormal behaviour. And when we see abnormal behaviour, we can then connect you to a clinician that can provide advice and help to help you settle your baby. So you might be wondering, how does this reduce parental stress? Well, literature tells us there's 3 main reasons parental stress is caused by. The first is perception of the baby's temperament. So what Goldilocks Suit is allowing parents to understand is their baby's temperament. It's helping them to understand what's normal for their baby and why they might be acting the way they are, a cry interpreter if you like. The other reasons are sleep deprivation and dyadic changes, or changes to the family structure. And we provide coaching for that in our app. So we believe addressing these 3 main pillars of parental stress will greatly reduce parental stress and anxiety. So who's the team behind this amazing new product called Goldilocks Suit? Well, as you've heard already, I'm Shem and I'm a medical device engineer and one of the founders. Jamin is a director and he is ex-KPMG and also led the entrepreneurial program at Kiwi Bank, so has real insights into strategy behind early businesses, strategy behind pricing and raising capital. Johnny's our community manager and looks after our digital marketing and being the face to our consumers. Elodie's our partnerships manager and she really deals with our clinicians and builds relationships with them. And Peter is a machine learning expert, previously worked with HP and was a researcher and developer. We also have an amazing advisory team that volunteers their time and their skills really complement the operational team. So Dr. Michelle is a serial entrepreneur in life science and currently has an AI business in the IVF space, which is a real key beachhead for us. Brent Hill is a top 20 CMO in Australia for the past 5 years. Brian Cunningham is the ex-CEO of Port Adelaide Football Club. Paul Huxtable has vast experience in fast-moving consumer goods and has established 5 global companies already. So what does the competitors look like? The first really is baby monitors. So baby monitors are great at telling you if your baby's awake or asleep and providing a video feed. But Goldilocks gives a bit more colour and information about your baby. So it can give insights into why your baby awoke, was that normal, was that abnormal, and then advice and helping you to settle them. There's also your in-person care, which can provide that same advice that Goldilocks is providing, but Goldilocks can do this at 3 AM. In-person care isn't always there and is often quite expensive. There are wearables on the market, but they're really focused on SIDS and to a certain extent sleep. Goldilocks really provides a holistic view of your baby and is providing coaching about everyday questions about why your baby is crying, rather than focusing specifically on SIDS and sleep. There are apps that provide some coaching to parents, but they do require manual input of data. Whereas Goldilocks is collecting all this data automatically and there's no manual input required. So how do we make money at Goldilocks? Well, primarily it's through the sales of our hardware. So our little Bluetooth module and our singlets we sell over our e-commerce website, other baby specific ones and Amazon. We're also working on a B2B2C pathway to market as well, where we're working with health insurers and healthcare systems who are looking to reduce the amount of times they send a midwife over to a parent's house. They can reduce this because they have Goldilocks to remotely monitor the baby's well-being. It also allows for early discharge, and it also allows for them to communicate directly with the patient via the Goldilocks app. So really what we're doing at Goldilocks is increasing the value of healthcare beyond the hospital walls. We're developing a premium side of our app as well, which can provide more qualitative insights for specific needs and requirements. We also have infomercials which are created by our clinicians, which can provide insights to the parents, and the clinicians pay to have that in there. We're also collecting really highly qualitative data about infants' development and well-being, and this is really critical clinical trials and research purposes, so we see that data we're collecting to be really valuable down the track. So where have we come as a business over the past couple of years? We've done hundreds of interviews with parents. We've done a 20 baby pilot study last year and done virtual sales on Facebook. We've raised 200k pre-seed from a VC firm in Australia and raised 100k through a crowdfunding last year. We've developed and certified a commercially ready product, and then we've sold 50 of these units as part of our alpha release in January this year. We then got feedback from this alpha release and have put orders in for another 300 units, and they're set to be delivered in June this year. But what we're really excited about is we've created smart clothing which provides informal and formal carers help to look after a patient at home, and the possibilities are endless. And we're currently working with some aged care providers to help develop technology to help the elderly live at home longer and more independently. We're also working with another company to make smart garments for people with disability to give them independence as well. But there's numerous other applications to people with pets, remote workers, fitness. But as well as that, we can further improve our product. Currently we're in the consumer health space and have all our regulations for that. But we could then move into the medical device space, which is a higher value product. There's numerous sensors that we can make and greater software developments and algorithm detections that we can build into our product as well. So we're on a mission to put all our patients in the Goldilocks zone, safe, happy and well, and would love to have you involved as well. Don't hesitate to reach out.
Hi, I'm Dr. Tal Rapke. I'm the founder and CEO of ScalaMed. And I've spent my entire career as a physician in the pharmaceutical industry and in digital health, really focused on finding the patient and helping bring them back into the center of their healthcare journey. Today in healthcare, every healthcare company, whether you're a large insurance company, all the thousands of new digital tech companies or pharmaceutical companies, everyone knows that the future of healthcare relies on engaging a patient with their health. And everyone's built an app to try and do so, yet in fact there are 318,000 health apps on the App Store. And astonishingly, only about 5% of all patients are truly engaged in their platform. And so it doesn't matter who has an app, everyone's looking for what's that feature that I can build or buy, that I can embed in my app that's going to bring the patients to me so that I can help influence them and I can help support them to make wiser healthcare decisions. And so when we looked at this and thought through what feature could that be, recognize that if you want to create a feature that works, it has to be something that the patients have to do, a job to get done, a transaction. The most frequent healthcare transaction, by a factor of 4 or 5, is a prescription. And yet today, the prescription process for the most part neglects or fails to support the patient, because prescriptions are either paper that go to a patient that don't give any level of support, or prescriptions actually flow from doctor and are sent straight to a pharmacy. The patients in the middle don't have the support or the information or the understanding to make an informed healthcare decision in the most frequent thing they do. And it doesn't actually create an access point with which to bring a patient inside our digital universe. So at ScalaMed said, what if we could rethink a prescription and enable prescriptions like we had with paper to be digital, and actually enable a doctor, any doctor, to send a prescription directly to the patient's phone. And that's essentially ScalaMed. We created a way for any doctor directly from their software to prescribe. Within a second, the patient can get a prescription on their phone, where we make it smart, surrounding that prescription with education and warnings and alerts and pricing and everything they need to make a wise decision, and then putting the power back in the patient's hands to select the right pharmacy for them every time they get a prescription. And when we do this right, ScalaMed sits right at the top of the value chain of prescriptions, able to support a patient with their health. But rather than making ScalaMed a destination, another one of the 318,000 health apps, we said, what if we could take our software as a plug-and-play solution with our APIs and plug it into any third-party software, enabling all of our customers who license our software to leverage a prescription as a way to engage the patient and pull a patient inside their software, inside their digital orbit. Let me explain how it works. Let's say it's your insurance company who's now licensed ScalaMed. They would tell their patients or their members, hey everyone, you now have this great opportunity to receive prescriptions inside our app because they've licensed ScalaMed. Next time you go to the doctor, tell them to send it to ScalaMed. The doctor, say, hey doc, send it to ScalaMed. In the system, press send. Within a second, the prescription is on your phone. They click on the link and open up ScalaMed inside the insurance company's app, where for the first time, the insurance company is able to show the patient where the lowest cost medications are, if there are alternatives, which pharmacies are available near them or are open at 3 a.m. in the morning. They're able to warn the patient with our technology about if they've been prescribed something they should not have been. They're able to educate them about what the medicine's for. And within 3 clicks, the patient, fully empowered, can send their prescription to any pharmacy for pickup or even for delivery. This creates 2 amazing things. Number 1 is it brings the patients inside our customers' digital orbit. The patient now is engaging in the most frequent thing they do every month, at least, coming into the app to manage their prescriptions. And hey, while you're here, how's your diabetes? How's your mental health? Would you like a telemedicine visit with that? And secondly, it brings visibility on what the patient's doing with their meds. Do they fill them? Are they out of refills? Do they need support? And is able to link the patient back into care. This creates an immense market opportunity, whether it's large hospital systems or insurers who are desperate to create a digital front door, leveraging prescriptions as a way to bring the patients inside their digital orbit, whether it's the thousands of well-funded digital health companies, many of whom are now on the public stock exchanges, who are looking to increase the number of touch points with which to influence and offer services to their patients, or whether it's pharma companies desperate to ensure the prescriptions that are written are supported and the patient is supported with a white glove service to ensure the patients get the medicine, understand how to take it, get the right support financially, and are able to send it to the right pharmacy to ensure the patient gets the right medicine at the right time. We're a B2B SaaS-based company. We charge a monthly fee for licensing our platform and a variable fee for every prescription that is pushed through the platform. We target in the health tech platform the product managers whose sole responsibility is to drive unique visitors and increase time spent in their platform, which we do. Payers and insurers, as we described, are able to access and influence the patient in real time. ScalaMed's been tested and tried in over 22 sites, over 6,000 patients across Texas. We've got advancing partnerships with the Mayo Clinic in Phoenix and in Rochester, Minnesota, Texas Medical Center in Houston, generating revenue with over 140,000 in ARR this year, on track for $1 million in sales at the end of this year and by our Series A in 2022. We've been funded thus far with family office money and angel investors, really helping us get to this particular point in time. Over the next 12 months, we're going to finalize our team, growing out our team across the globe. We're pushing our sales, really pushing hard at sales to grow our sales opportunities. We're supporting our first customers' growth, enhancing our APIs to make an even smarter prescription. Our extensive pipeline is advancing with huge opportunities for us in market. Our team of top-notch developers who have built over 8 startups in their time, have over 60 years in experience in healthcare, have successful exit as well behind us. Our product lead have built a tech for many years, and our customer support and success team are on the ground, really making waves with our new solution. We're raising a $2.5 million seed round to really focus on building out our product so that within 5 lines of code, any customer can embed, plug and play ScalaMed in an afternoon, and continuing our sales and marketing push to really grow our footprint and our use cases across the globe. We at ScalaMed have reinvented prescriptions. We've taken the most frequent thing that a patient must do in healthcare, packaged it up, and made it available as a plug-and-play solution inside any app. Any customer looking to engage and influence a patient while they're managing their medications can license ScalaMed today to change the future of healthcare and to truly help patients get the best possible health outcome. Thank you so much for this opportunity, and I look forward to partnering with you as we grow our impact in health.
Hello, my name is Aga. I'm the co-founder and managing partner of Future Health. Future Health is an early stage angel investment group based in Singapore with a focus of identifying and investing in early stage health technology startups in the region. I'd like to thank all the contributors to the Asian pitch competition around the world. It's interesting to see the problems being solved. I'd like to thank you personally for your time and efforts for putting your pitches forward. I'd also like to announce the 2 finalists for the Asian pitch competition, who are Opuz and ScalaMed. I congratulate both companies and look forward to hearing more about your business shortly.